For evaluation, we can look at the bilirubin level by using either the transcutaneous bilirubin screening, where we use an instrument that touches the baby's skin and gives a readout of the estimated bilirubin level, or with a total serum bilirubin with a blood test. We can look at the baby's blood type and then also check Coombs or DAT testing. And this is going to show if the mother's antibodies are on the baby's red blood cells. If this is the case, the antibodies can break the red blood cells down, which will release more bilirubin and increase the baby's bilirubin levels. We can look at the reticulocyte count to get an indicator of if there are a lot of these being released. That's an indication of hemolysis. And then we're going to use our specific nomograms to really look at what the bilirubin level is in relation to the actual number of hours of life that the baby is. The main treatment for this is going to be phototherapy. Phototherapy will change the unconjugated bilirubin to conjugated bilirubin, which will be water soluble for excretion. We want to have eye protection for the baby if we're using phototherapy, and we should have them just in a diaper so that as much skin is exposed as possible. When a baby's using phototherapy, we're going to be monitoring hydration and we're going to be monitoring temperature. So we can use the lights, we call them the Billy lights, or there's also a Billy blanket that wraps around, and that's going to have the same effect. We want to promote frequent feedings and lactation support if she's breastfeeding, because the more the baby's eating, the more the baby's stooling to help with excretion. And then we can consider exchange transfusions in severe cases, especially with like RH incompatibility. If we do an exchange transfusion, they actually remove some of the baby's blood in small amounts and they replace it with compatible blood.